So I thank AIOC for this opportunity. Good afternoon, respected chair and audience. So I'll be presenting this paper on incidence of aggressive ROP and management with biosimilar ranibizumab and laser in a tertiary eye care center in Eastern India. So nil financial interest. So we are all aware of the normal practice of laser in stage 3 zone 2 plus and the conditions of aggressive ROP where we are not having a very developed retina. And how do we manage these patients? Not only laser. So we have a few definitions which have come up. The aggressive ROP is not the typical aggressive posterior ROP which used to tell before. So this is a IC-ROP classification 3 where we have aggressive disease beyond the posterior retina and in larger preterm infants, particularly in developing world with limited resources. Anti-VEGF is being tried in these patients, started with beat ROP with bevacizumab, ranibizumab in Rainbow trial, aflibercept is approved by FDA for treating aggressive ROP, and biosimilar molecules because of the cost, the quantity, and it has proven to be effective in multiple indications, got approval, and now has proven to be effective in ROP2. But there is a thing that recurrence of neovascularization needing retreatment or rescue laser approximately 7 weeks after anti-VEGF were reported in studies as well as all meta-analysis. So the aims and objectives was to find out the incidence of aggressive ROP in between April 21 to April 23, efficacy of this intravitreal biosimilar molecule followed by laser to vascular retina after a specified time interval in regression of the disease in a tertiary eye care center and comparing the efficacy of the drug in different zones of aggressive ROP. So it was a retrospective study in the vitreoretinal department in Atralam. The study was approved by a local ethics committee. Informed consent was taken. A minimum follow-up 6 months was done after the primary procedure. So study calculated aggressive ROP among all the screen babies. Aggressive ROP infants received intravitreal biosimilar ranibizumab in both eyes in a single sitting from one single vial. Weekly follow-up of for 1 month and then 2 weekly till significant retinal vascularization was achieved. And laser photocoagulation was done to vascular retina at a stipulated interval after injection biosimilar ranibizumab. So this was a 5% population, 24 babies who had laser and ranibizumab in the aggressive ROP group. Type 1 disease was seen in 50 babies out of 522 who had only laser. So these were the 48 eyes of 24 babies of aggressive ROP which were analyzed. And this was the average gestational age, 29 weeks out of 13 female and 11 male babies. Time of presentation was average 30 days. Birth weight was 1302 gram. Days of in ICU stage was around 30 days. So all aggressive ROP around 4.5% were treated with anti-VEGF and were lasered after a mean interval of 5 to 7 weeks. Type 1 disease was seen in 50 babies which required only laser photocoagulation. Complete regression of aggressive ROP was seen in 46 eyes at a median of 5 weeks. 4 eyes had focal elevated fibrous ridge at the posterior laser margin at 6 months after laser. And there was no eye with recurrence of neovascularization or tractional detachment in less than 6 months follow-up. And 1 eye needed additional laser and 1 eye did not turn for follow-up after laser. So if we, this was the tabulation of the aggressive ROP zone 1 and zone 2 posterior. There was not, the difference was not significant in gestational age, in birth weight, in ICU stay on the grades of prematurity. And if you see the last two things, the zone 2 anterior vascularization 5 weeks after ranibizumab was significant in both the groups, almost around 76-72%. And few babies, around 4 babies, progressed to zone 3 vascularization 5 weeks after injection ranibizumab, but the difference was not significant. So this was the demographic data of retinopathy prematurity in India. Their incidence of ROP was high, 32%. We had reduced incidence probably because of more inborn babies, but the first year aggressive ROP incidence was more or less compared to the second year, showing an increasing trend. Ranibizumab was this was a rainbow study which showed that there was no adverse effect to ranibizumab because we used a biosimilar ranibizumab, but 38% of eyes in this trial reached full vascularization after 24 weeks post-injection, and 91% eyes had a disease in zone 2A or zone 3 4 weeks after injection, converting aggressive ROP to a type 2 disease. This was a study from Gujarat which showed that there was a recurrence in 35% of babies in after 7 to 8 weeks of injection. So the limitation, it was a retrospective study, lack of wide field imaging and comparison group with innovator ranibizumab. Laser was planned at a fixed interval to avoid disease recurrence, repeat injection and possible general anesthesia. This may have changed the disease recurrence course and effect of injection in few babies, and long-term follow-up and comparison laser group was not possible. So conclude, incidence of aggressive ROP, which is a potentially blinding disorder, is not insignificant in Eastern India. Biosimilar followed by laser photocoagulation at a specified interval appears to be safe, economic, and effective in having excellent structural outcome. All the eyes could be managed well with one single anti-VEGF injection with single laser and avoiding long-term follow-up, repeated injection, and general anesthesia in bigger babies and increased compliance. And there were no safety concerns with ranibizumab. So this is one of the cases. Thank you so much for your patient hearing.
And next.
Thank you so much. In the interest of time, we are going to call the next speaker. If there are any questions, we'll take it